You lose a tooth. Maybe it's been bothering you for months. You finally get it out, the pain is gone, and honestly, you feel fine. You can still eat, you can still smile, nobody can even see the gap. So you put it in the I'll deal with it later pile. I hear that all the time in my practice, and I'm not here to judge, but I am here to tell you that later almost never comes. And by the time it does, what started as one missing tooth has quietly set off a chain reaction inside your mouth that is significantly harder and significantly more expensive to address. Not to scare you, that's not what we do here, but because understanding this genuinely changes the decisions you'll make. Let's get into it. What's up, everyone? Dr. Eric Jackson here. Hope you're doing well. I've been practicing dentistry here in Downers Grove, Illinois for almost 20 years. And today's video, I want to walk you through exactly what happens biologically when a tooth goes missing and nobody does anything about it. The very first thing that happens after a tooth is removed, and I mean before any shifting, any bite changes, is bone loss. And most people have absolutely no idea. Here's how your body works. Your jawbone exists for one primary reason: to support your teeth. The second that tooth is removed, your body gets the message loud and clear that it no longer needs to maintain that section of bone. And your body is extraordinarily efficient at this. It stops sending resources there. The bone begins to shrink. Now, I know what you might be thinking. How fast can this really happen? The answer might surprise you. Meaningful bone loss starts within the first few months, not years, months. And once it's gone, it doesn't grow back on its own. Have you ever seen someone who's worn full dentures for many years? That collapsed, sunken facial appearance that no denture can really fully correct perfectly? That's the end result of decades of bone resorption. What's happening to your jaw after a single missing tooth is the same process, just localized to one spot. And here's why this matters right now. If you're considering what to do about that missing tooth, preserving bone from day one makes everything easier down the road. Let me explain what I mean. Bone loss is domino number one. Let's talk about which domino falls next. Here's something I think most patients genuinely don't know about their own teeth. The teeth are never truly still. Even in a perfectly healthy adult mouth, your teeth are in a constant, slow state of movement. They're always seeking contact, horizontal contact with the teeth on either side, vertical contact with the tooth directly above or below. That's how they maintain stability. Pull one tooth out of that equation, and you've removed one of those contact points. The tooth behind the gap begins to tip forward into the space. The tooth directly above or below begins to erupt into the void. Now, here's the misconception I encounter all the time, and I want to dispel it directly. Many patients believe that this stops after a certain age. That once you're a full-grown adult, your teeth are done moving. They're not. Your teeth are in motion throughout your entire lifetime. A 55-year-old who loses a molar will experience the exact same drifting as a 35-year-old. Maybe on a slightly different timeline, but it still happens. So now we've got bone loss and tooth movement happening simultaneously. Two dominoes down. The next domino affects how you eat, how you speak, and eventually how your jaw joint holds up over time. To understand what happens to function when a tooth goes missing, we need to spend about 60 seconds on what your teeth are actually designed to do, because they're not all doing the same job. Your front teeth, your incisors, they're scissors. They're specifically built to slice. Think about biting into a sandwich or a piece of bread. That's your front teeth doing exactly what they were engineered for. Your back teeth, your molars, these are the mortars and pestles, heavy grinders designed to take what the front teeth slice and break it down before swallowing. And your canines, your eye teeth, they function the way that dog would naturally tear into a piece of meat, which is actually where they get their name, by the way. When you lose a tooth, you would lose that specialized function with it. And here's what patients do. They compensate. They start trying to grind with their front teeth. They start trying to slice with their molars. And those teeth were simply not built for that load or that use. The result is accelerated wear, increased sensitivity, microfractures. The remaining teeth start breaking down faster because they're doing a job they weren't engineered for. Patients also instinctively start favoring the side of the mouth that has a full complement of teeth. Every meal, every chew, the force concentrates on one side. And that asymmetry compounds over time, day after day, meal after meal. Speech takes a hit too, particularly when front teeth are missing. Phonetic sounds like the F in 55 and the S in 66. Those require very precise contact between your lips, your tongue, and your teeth. Remove that contact and the air escapes incorrectly. The sounds get sloppy. Here's where all that uneven force eventually ends up. Your temporomandibular joint, your TMJ, the hinge that connects your lower jaw to your skull. Think about this for a second. Think about an old sports injury to your hip or to your knee. When something hurts there, you limp a little bit, you favor it. And what happens over time? You throw off your spine, your back starts to hurt, your shoulder compensation kicks in. One imbalance creates a full chain of imbalances throughout your entire skeletal system. Your jaw works exactly the same way. When force is no longer distributed evenly across both sides of your mouth, meal after meal, day after day, your TMJ absorbs the difference. And over time, that shows up as jaw pain, clicking, popping, headaches, difficulty opening your mouth fully. Dental health depends on nice synergy, even symmetrical forces distributed across a complete, properly aligned arch. Lose that, and the joint pays the price. Here's the genuinely good news. There's a solution for every single patient, and the right choice depends on your specific situation. Option 1, a removable partial denture. Non-surgical, economical, and in certain situations, genuinely the most sensible choice. If you're missing several teeth scattered across different areas of the mouth, think about what the alternative looks like. You'd be talking about a significant number of individual implants, each requiring its own surgery, its own healing period, its own crown, and a cost that adds up quite fast. Or a full arch bridge of considerable length, which has its own level of complexity, expense, and irreversibility. A well-made removable partial denture can replace all those teeth in one appliance, restoring your chewing function, maintaining the vertical and horizontal stability we talked about, and doing it in a fraction of the time, cost, and clinical complexity. You take it in and out. It's not a compromise for the right patient. It's the right answer. Option 2, a fixed bridge. Picture a bridge you would drive over a river, a support structure on each bank spanning the gap in the middle. In dentistry, the teeth flake in the empty space are crowned, and the false tooth is supported between them. Permanent, cemented in place, functions like natural teeth. And here's something worth knowing. If the teeth on either side of the space already have large or aging or failing restorations, a bridge can actually be the most sensible choice. You're addressing multiple clinical problems at once, efficiently, without the unnecessary complexity. That's good dentistry. Option 3, a dental implant. A titanium screw placed into the jawbone to replace the natural root of the tooth you lost, without touching the tooth next to it. Once it integrates with the bone, a crown goes on atop. It looks, feels, and functions like a natural tooth. And because it replaces the root, it stimulates the jawbone, which helps preserve bone long term. Now here's something most patients don't realize, and this is where we circle back to what I said at the very beginning of this video. If you're going to extract a tooth, the absolute best time to preserve bone is at the moment of extraction itself. This is called a socket graft. We remove the tooth and place bone graft material directly into the socket on the same day. Often, we'll place a temporary bridge over this space while everything heals underneath. Why does this matter so much? Because preserving bone immediately is far more predictable and far easier than trying to rebuild bone months or even years later after it's already been lost. It's the difference between prevention and reconstruction, and prevention always wins. For most teeth in the mouth, excluding wisdom teeth and sometimes the second molars depending on the situation, this is something I discuss with virtually every patient facing an extraction. And I can perform this right here in the office, which patients really appreciate. You come in, we extract the tooth, we place the graft, and you leave with a temporary restoration. No bouncing between multiple offices, no multiple surgical visits. It's streamlined, and it keeps your options completely open. Here's what I mean by that. If you're not sure whether you want an implant, we can extract and graft on day 1. Then, over the next 3 to 6 months, while everything heals, you actually live without the tooth. You experience the space, you figure out if it bothers you. You decide on your own timeline whether replacement is something you want. And the beautiful part, because we preserve the bone on day 1, your options remain excellent whenever you make that decision. The door stays open. For patients that are certain from the start that they want an implant, I sometimes work very closely with trusted specialists, periodontists, an oral surgeon, depending on the case. In those situations, I'll often refer the entire surgical phase, the extraction, the graft, the implant placement. The specialist controls the process from start to finish, which is good for everyone. Then you come back to me for the restorative work, the crown that goes on top. It's a team approach, and it's the right call for the right patient. But the point is, lack of bone, uncertainty about implants, failing restorations next to the space. None of these are reasons to do nothing. They're all situations we can navigate thoughtfully together. Here's what I want you to take away from today's video. A missing tooth is never just cosmetic. It's a structural problem. And if it's left unaddressed, it becomes a cascading biological problem. Bone loss, shifting teeth, bite breakdown, joint damage. Every single consequence I walked you through today is preventable with timely, thoughtful care. If you've got a missing tooth, or if you've been told you need an extraction, please don't put this in the "I'll deal with it later" pile. Come in, let's sit down and put together a plan that actually works for your specific situation, your timeline, and your budget. Jackson Family Dentistry, 2033 Ogden Avenue, right here in Downers Grove, Illinois. Give us a call at 630-963-6750 or visit us online at jacksonfamilydentistry.us. New patients are always welcome, and we would love to take care of you. If this video was helpful, please give it a thumbs up and hit subscribe. I put out content like this regularly, and I'd love to see you in the next video. I'm extremely passionate about modern dentistry, and I love discussing it with patients, so don't hesitate to reach out in the comments below. Thanks for watching. Take care now. Bye-bye.